Nikita welcome you in Pharma online lecture series. Today we are going to see liquid dosage form. So on my screen you can see many containers. As you know, what is the dosage form? The dosage form is the form in which the drug is given to the patient for administration. So, as it is, you cannot eat the drug or you cannot apply the drug. You have to convert it into the suitable form having accurate drug content in a stable way giving to the patient for administration. So when drug is either dissolved or in dispersed form in a suitable liquid, suitable vehicle, suitable solvent, it is the liquid dosage form. So you can see here many different forms of the liquid dosage form. A solution is there, or you can say syrup, then some oral drop is there. This is the nasal drop or eye drop, ear drop. Then you have an ampule, and you have here the vials in which the liquid dosage form can be given to the patient. Now, this liquid dosage form is either prepared by dissolving or by dispersing or suspending or by emulsification method. So if your drug is having good solubility and it has less compression property, you can formulate your drug as a liquid dosage form. So based upon solubility of drug and other excipients, you can dissolve it in the suitable solvent or vehicle and you can give it as a solution form. If your drug has a good solubility but it do not undergo compression, then you can prepare it as an suspension form where the drug is suspended or dispersed in a suitable vehicle or liquid and given as a suspension form. Then many oil-based drug or many oils can be formulated as an emulsion where both aqueous and oily phase are mixed with the help of emulsifier, and the emulsion-based liquid dosage form can be prepared for the patient. So if you see what are the different advantages and disadvantages for the liquid dosage form. If you see classification based upon use, they are either internal use, external use, or the parenteral use. So internal use formulations are taken orally, they go into your digestive tract, they enter into your stomach. External use formulations, they are used for topical formulation. So many drops which you instill into eye, ear, nose cavity, then many formulations which you apply topically on mucosal membrane are also for external use. Use in mouth cavity like gargles, mouthwash, paints, they are external use. So external use formulations which you instill into body cavity like eye, ear, nose, vagina, then onto your skin and into your mouth cavity, these are the external use formulations. Parenteral use formulations which you directly inject into the blood circulation. So various subcutaneous, intradermal, intramuscular, intravenous injections are the parenteral use formulations. Now, based upon phase, whether it is monophasic, biphasic. Monophasic means only one phase exhibit. It is a solution formulation. The uniform mixing is there. System appears homogeneous. In case of biphasic dosage form, you have two phases which are mixed together. So suspension and emulsion are the example of biphasic dosage form. In case of emulsion, the drug is mixed into oil and water by using of the emulsifier and they are making one phase. So suspension and emulsions are example or biphasic liquid dosage form. Monophasic liquid dosage form, if it is for internal use, you have solution, you have syrup, linctus, aromatic water, drops, elixirs, mixtures, and draughts. These are the various examples of monophasic internal dosage form. Monophasic external dosage forms are the mouthwashes, gargle, throat paint, various drops which you use for ear, eyes, nose, various sprays, then douches, enemas, various solutions which you apply on skin or topical application. Then lotions and liniments, these are for the external use. And parenteral use, these are various aqueous injections or various oily injections also are the parenteral formulation, which are liquid dosage form. And in case of biphasic dosage form, you have emulsion, and emulsion which can be used for internal purpose or external purpose. Suspension also internal use and the external use. Next you have is based upon whether they're aqueous or alcoholic or hydroalcoholic. You know that the solvent system may be aqueous, but if the drug solubility is less, you can use the alcohol to make it solubilize. So in case of aqueous, you have solution, various syrups, linctus, drop, mixture, gargles, throat paint, sprays, douches, enemas. These are some examples which come under aqueous solvent system or aqueous vehicle system liquid dosage form. And in case of the alcoholic or hydroalcoholic, you have elixir and spirit. So various excipients which are used in the liquid dosage form. Liquid dosage form, they are the drug is solubilized into the solvent or suitable vehicle. But to maintain the stability of that formulation, you have to add other ingredient also. So the other than the drug, various other excipients are added such as preservatives, sweetening agent, coloring agent, viscosity building agent, suspending agent or emulsifiers, density modifier, antioxidant, and chelating agent. So, vehicle or solvent or the co-solvents are used to solubilize the drug and to make it in solution form. So, various types of solvents are used. Preservatives to preserve the prepared formulation from action of the microbes or fungus. So, various antimicrobials, antibacterial agent are used as a preservative. Then sweetening agent, coloring agent, and flavoring agent. As you know, the liquid dosage form you take orally, and compared to solid dosage form, tablet capsule, the area of contact is more for liquid dosage form. So the taste of drug is more noticeable when it is in liquid form. So to mask the taste, sweetening agents are added, and to increase the patient acceptance or palatability of the prepared formulation, coloring agent, flavoring agents are added. So flavoring agent, coloring agent, and sweetening agents are added into formulation to increase the palatability and patient acceptance. Then you have viscosity building agents. Various viscosity building agents are used to maintain the thickness of formulation. So if you prepare formulation suspension, you have to maintain the thickness so that the all particles do not settle down. The particle should be suspended for sufficient time till removal of dosage form from the container. So if it is liquid, you just shake it, and if it is settled down, then you will not have uniform drug distribution inside the formulation, and the dose delivery is also not accurate. So to overcome this, the suspending agents are added. Then again, this viscosity building agent, if you use it for topical formulation, the formulation should adhere at that particular site for some time to give the therapeutic action. So it should not flow to retain at that particular position. You are increasing the viscosity by adding viscosity building agents. You have emulsifiers. As you know, the biphasic system, that is the emulsion, when you prepare emulsion containing water and oil, they have high surface tension between them and they do not mix with each other. So when you add the emulsifier, they overcome this surface tension, and they reduce the surface tension between these two phases, and the phases are mixed together. Next, you have density modifier. To make the prepared formulation with having similar density to the body fluid, density modifiers are used. Antioxidant and reducing agent to prevent oxidation of drug from the surrounding air. When you prepare the formulation and you store into the container, the head space into the container or the empty space into the container is filled with the air, which may lead to oxidation of the added drug. And to prevent that, the oxidizing agent or reducing agents are added to increase stability of your prepared formulation. Chelating agents, many metallic impurities are present, may come other added ingredient. So to avoid interaction with the metallic impurities, the chelating agents are added which form complex with these metals and prevent the degradation of drug and increase stability. So these are the various excipients are added into the liquid formulation which increase stability of the formulation and gives the palatability and acceptability. So solvents, which are the various solvents you can use? You have aqueous, alcoholic, hydroalcoholic, oily solvent. So aqueous water is used, it is cheap, readily available, universal solvent, and many drugs are soluble in water. So water is used as a solvent. But if the drug is having solubility problem in water, then co-solvents like some alcohols can be used to increase solubility of the drug. Non-aqueous solvents such as oils, almond oil, arachis oil, cottonseed oil, olive oil can be used as a solvent. Then various alcohols are used because alcohol increases the solubility of the drug. So various external formulations, the alcohol are used, and for the oral formulation, if you use the alcohols, you have to mention the percentage of alcohol which is utilized into the formulation. So ethanol is used as an solvent. Then polyhydric alcohols. So polyhydric compounds are basically compounds which contain the multiple hydroxy group. So various glycols, glycerols are used as the various other solvents like isopropyl meritate, isopropyl palmitate are used. So based upon the property of drug, solubility of the drug, alcoholic, aqueous, hydroalcoholic. So next you have is an buffer. Buffer are the agents which use in preventing change in the pH of the formulation. So pH plays a very important role. pH helps in solubility, dissociation, even absorption and the bioavailability of the drug. So you have to maintain the pH and it should not change during the shelf life or during the storage period. Citrate, lactate, phosphate, gluconate, and borate buffers can be used to maintain the pH. So, borate buffers are used for the topical formulations. You have density modifiers. So, when you prepare formulation as an injectable, the formulation should have same density as compared to your body fluid. Various anesthetic formulations, when you prepare, they are introduced into your spinal fluid and they should have same density as spinal fluid. So dextrose is used to maintain the density and used as a density modifier. You have antioxidant and the reducing agent. So as I have told you, the oxidation may cause the degradation of drug due to present air into the headspace of the bottle, and to prevent the oxidation, the oxidizing agent and reducing agents are added. So various reducing agent like sodium metabisulfite and antioxidant like butylated hydroxyanisole and butylated hydroxytoluene is used. Then you have tonicity adjuster or tonicity modifier. The osmotic pressure of your prepared formulation is more or less, then they may cause irritation. Your liquid dosage form should not be hypertonic, hypotonic, it should be isotonic to your body fluids. So various dosage form which you instill into the ocular cavity, nasal cavity, the formulations which you apply to the mucosa and the parenteral formulation should be isotonic to your body fluid, and sodium chloride and dextrose are the ingredients are used to maintain tonicity similar to your body fluids. Next you have the viscosity modifier. Suspensions, the drug is in undissolved form and it is distributed into the vehicle or solvent. So to have proper distribution of the drug throughout the system, the drug distribution should be uniform inside the container and there should not be underdose or overdose given to the patient. So to maintain uniform distribution of the drug inside the container, the viscosity of your system should be suitable so that it maintains the drug particle uniformly suspended inside the container. So various viscosity modifiers such as gelling agent like cellulose, HPC, HPMC can be used. Povidone can be used. Carbomers such as carbopol can be used. Various gums can be used. Alginate can be used. So these are basically gelling agent which increase the viscosity of your formulation and helps in maintaining proper uniform distribution of the drug inside the container. You have preservatives to avoid degradation due to the microbial growth as it is containing water. So you should have an added preservative. So various benzoate and parabens, benzalkonium chloride, they are used as an preservative. Now with the various alcoholic formulations, sometimes the alcohol content itself act as a preservative, and in case of syrup, the sugar content is so high that because of the high osmotic pressure, you need not to add preservative and they act as a self-preservative. Chelating agent to bind with the metallic impurity, chelating agents are used. Disodium EDTA and phosphoric acid is used as a chelating agent. Surfactant or the emulsifiers. You have various surfactants and emulsifiers which you can use. So surfactants are and emulsifiers are used to make emulsion to increase solubility of the drug. So various emulsifiers like gum, the acacia, tragacanth, they are used, these gums are used as an emulsifier, and various surfactants are used to increase the solubility of the drug. So cetrimide, sodium lauryl sulfate, and various gums are example for the surfactant and the emulsifier. Next, you have the sweetening agent, coloring agent, and the flavoring agent. As you know, the liquid dosage form should have good palatability for patient acceptance. So, various sweetening agents are used: natural sweetening agent, artificial sweetening agent. So, various natural sweetening agent like sucrose, inverted sucrose, fructose, polyhydric alcohols such as sorbitol, glycerol, mannitol can be used. Artificial sweetener agent like sodium saccharin, sodium cyclamate, and hesperidine can be used as an artificial sweetener. Natural sweetening agents are used, but they have limitation because of the sugar content. They are not suitable for the diabetic patient. And artificial sweetener can be used for the diabetic patient, but they are bitter after taste or metallic in taste, and some of them are also having the carcinogenic tendency. So even they have low glycemic index and they are used for diabetic patient, but they have drawback the carcinogenicity and bitter after taste. Next, you have the coloring agent. To increase the acceptance, the coloring agents are used. So, various natural coloring agents like carotenoids, chlorophyll, anthracene, caramel, amaranth, erythrocene, eosine, tartrazine. These are the various examples of the natural coloring agent. And synthetic coloring agent like coal tar dyes, sodium salt of sulfonic acid can be used. Next you have is the flavoring agent, peppermint oil, lemon oil, various herbs and various spices are used as a flavoring agent. Then artificial perfume and flavors, these are available as an alcoholic or aqueous solutions or the powders which can be used as an flavoring agent for preparation of the liquid dosage form. So key points to remember for liquid dosage form is what is the definition of the dosage form, which are the route through which you can use the dosage liquid dosage form, advantages and disadvantages, packaging, container closures, labeling directions, storage condition, the classification based upon their use, based upon their phases, and the various formulation excipients which you use for the preparation of the liquid dosage form. Kindly like, share, subscribe my channel and enjoy learning. Keep growing with Ynod Pharma. Thank you very much.